Hi, this is Ethel, your clinical instructor, and this time I'm going to demonstrate to you the proper wearing or donning and removing of personal protective equipments, and I will briefly discuss its purposes. We cannot deny the fact that there are lots of microorganisms which can cause infection in almost all of the healthcare facilities. And we all know that the single and the most effective method or way of preventing infection is through hand washing. But wearing protective or personal protective equipment can help a lot. Then, what are the purposes of using personal protective equipment? These are protecting the healthcare personnel or healthcare providers from being contaminated with microorganisms which can be found from their patients. And second is preventing the cross-contamination of infection from one patient to another by protecting these patients. Now, what comprises these personal protective equipments? These are the unsterile gloves, facial masks, and the gowns. Okay, now I'm going to demonstrate to you how to wear the personal protective equipments and how to remove it properly. Before doing any procedures, you have to follow some protocols. First is identify the patient correctly by asking the patient's name, and then explain the procedure to the patient or what are you going to do with them, and so that also they will know how to cooperate. And then wash your hands, gather the equipments that you're going to use, and in this procedure we are going to use facial mask, the gown, and gloves. Okay, the first that you are going to wear is the clean gowns. So pick up a clean gown and allow it to unfold in front of you, avoiding the surface which is soiled or avoiding any soiled surfaces. And then slide your arm and hand into the sleeves of the gown. Okay, and tie the upper tie of the gown at the back or on your neck. Okay, and then overlap the gown around the back and fasten the ties around the waist and tie it at the back, or you can tie it in front so that it can be removed easily. Next is don face mask. Okay. Locate the top edge of the mask. The mask usually has the narrow metal strip along the edge. So this is the top edge of the mask. And then hold the mask by the two strings and then place the upper edge of the mask over the bridge of the nose. And then tie the upper ties at the back of the head, or secure the loops around the ears. Okay? And then secure the lower edge of the mask under the chin and tie it at the nape of the neck. Okay. And then adjust the metal by firmly adjusting it so that it will properly fit the bridge of the nose. Okay. So now we are wearing, or I am wearing, the gown and the mask. The last thing that I'm going to wear is the gloves. There is no special techniques required in wearing unsterile gloves or clean gloves. Just make sure that the thumb of the gloves is along your thumb. Okay? So, slide your hand inside the clean gloves. Pull up the gloves so that it can cover the edge part of the gown. So the same thing with the other gloves. Wear it in the same manner by pulling it up. Okay, pull it up so that it can cover the edge of the gown. Okay. So now we are protected when doing any procedure to our patients by wearing the face mask, the gown, and clean gloves. And now, I'm going to show you how to remove it properly. The first thing that you are going to remove is the glove, because this is the most soiled one or the most dirty among these protective equipments. But before removing the gloves, you have to untie your gown if the tie is in front of you. So untie it if the tie is in front of you. And then remove the gloves. How to remove it properly? You have to grasp the palm part of the gloves by pulling it from your hand and grasping it inside the other gloves. And then, using the two fingers of your ungloved hand, remove the other gloves by pulling it down without touching the soiled part of the gloves, and invert it so that the soiled other half of the glove, which is soiled, is inside the glove, so that you will not be contaminated with any microorganism. And then discard it to the proper disposable garbage can or bin. And then we have to do hand washing. Next is we have to remove the facial mask. In removing the facial mask, you have to remove first the lower tie, not the upper tie. This will prevent the edge of the top edge of the mask from falling onto the chest. Then we can prevent also contamination. So remove the lower tie of the mask. And then remove the upper tie of the mask. While holding the mask this way, you have to throw it to the proper disposal bin without touching any part of it, especially when it is soiled with any body fluid splashes. Okay? And then the last thing that you're going to remove is your gown. Okay, untie the tie from the nape of the neck or from the neck, and then remove it by touching the inside part of the gown and pulling it down from your shoulders and removing it, as the outside part of the gown should be the one inside now. Okay, or the most soiled part of the gown should be inside while rolling it away from your body so that you will not be contaminated. Okay? And then again, dispose it to the proper disposal bin. And the last thing is, we have to do proper hand washing properly again.